when it comes time for your hip replacement, we also talk with people about what needs to go on in order to help ensure success. Because again, there's no free lunch with any kind of operation, and there are some risks. And so, for example, anybody that might be a smoker or using any kind of inhalational vape products or anything like that, those things can put you at a high risk of having a problem. And so we talk to people about cessation from all of these kinds of things, because you really want to stack the deck in your favor and not lead to any kind of potential complications relating to wound infections or anything like that. So those things are really important. For example, diabetic patients, we see them every single day, and it's very important for people to have very well-controlled diabetes, and we look very closely at hemoglobin A1C and these kind of metrics in order to make sure that people are really optimized for surgery. Nutritional considerations are also incredibly important, and so oftentimes we take care of patients that tend to be a couple of years older, and as they get to be a few years older, sometimes their nutrition takes a back burner. They just don't think about eating, and they just don't eat really hearty foods, and sometimes we need to check and make sure people are nutritionally ready to undergo the stress of the operation. And so optimization for a joint replacement it's really for the whole person. We need a healthy as they can be person leading into the operation to minimize any of the risks and potential complications that might result from a stressful operation. It's also important for people to be as well conditioned as they can be leading into the operation, because we're going to stress the system. And so we encourage people to do what they can leading up to the operation, and to be as strong as they can leading up to the operation, so that they start at a higher level when we get them back on their feet and get them back in action after the surgery.